Okay, so this is the start of the question and answer station, and this is the paper that we've been using for this, and there's the student instructions. So a 2-year-old girl attends an emergency appointment with her mother, and the mother says that Daisy has a high temperature for 24 hours. Okay, so we're just going to sit back down now, shall we? Okay, fine. So, okay, I'm going to be the nurse practitioner, and Sarah's going to be asking me some questions, and the examiner will just be ticking off the tick box normally. Okay? Yes, just read the questions out to me. Yeah.
Okay, so question 1. What
Yes.
questions would you include in your history taking for Daisy?
Right, okay. Well, I want to know if she's actually got a temperature, because the mother might say she's got a temperature, but that might not be actually what she's got, so I need to check what she means by that. Has she actually recorded her temperature? And if so, how did she record it? And when did she last record it, and what that reading was? And then I'd want to know if she's had any medicines like Calpol or ibuprofen, and how often she's been given that, and what dosage, if she knows if that's the correct dosage, if she's been given that. And I'd also want to know when she last had it. Yeah. And then I'd want to know, has anyone else been unwell in the family, or anyone that the child has been with? So I might want to ask about childcare arrangements as well. You know, for example, if she has a childminder, or if she goes in the nursery. And then I'd want to know about how does she appear otherwise? Does she seem otherwise unwell? And then I'd want to know about her appetite. So is she eating as normally? Is she drinking as normal? I'd want to know about her urine output. Is she passing urine as normally? I could also ask about the urine, you know, if it had any odour to it, or if she appeared any discomfort when passing urine. And then I'd want to know about any other sorts of symptoms apart from the fever. So she's just told me she's got a fever, hasn't she? Yeah, okay, so has she got has she complained of any earache? Has she had any discharge in the ear? Has she had any sore throat? Has she had any coughing? Any abdominal pain? Then perhaps might want to think about more serious things, you know, like meningitis type things. So has she had any complaints of a headache or light sensitivity, or has she complained of a painful neck, or has the mother noted a stiff neck? And then I probably want to ask about, you know, her past medical history. So was she born on time? Was it a normal delivery? Has she had any significant medical problems since birth? Was she breast or bottle fed? Does she take any medicines regularly? Has she got any allergies? I've already checked, you know, to see if anyone else is unwell, like her siblings. And then I might want to know if they've got any recent travel history as well.
Right, okay.
Probably do.
Okay, so question 2.
Yeah.
What physical examination and diagnostic tests might you carry out on Daisy?
Right, well, I just want to do sort of general inspection. So when I'm doing the history taking, I'd observe how she is with the mother. I'd want to look at her interactions with the mother. You know, was she clingy, or did she seem okay? Was she, you know, running around the room, or, you know, even before I saw her, was she playing with toys in the waiting room? That would give me quite a lot of information. I want to see if she's quiet or withdrawn or active. I want to look at her general skin colour. Is there any signs of pallor that I might be concerned about? And then I'd want to check her temperature in the clinic, even if the mother's done it recently. I want to do a pulse, a respiratory rate. You know, perhaps if I had a sax machine available, I could do that. So it's what, physical examination, is it?
Yeah, what physical examination
Yeah.
and diagnostic
Okay,
tests.
yeah, fine. And then I just want to examine her from head to toe. So I want to do ENT examinations. I'm looking at her throat, looking at ears, palpate her neck glands. I want to have a listen to her chest, palpate her abdomen as well. And then I just want to, when I'm doing that examination, I want as much of her clothes off as possible, so I could look for any suspicious skin rashes. I could also check her perfusion as well when I was doing that. I want to check for light sensitivity with the pen light, and while I'm doing these things I can check for any signs of neck stiffness as well that might indicate meningitis. I suppose, if it's possible to get some urine, I could maybe try and test that as well.
Okay.
Yeah.
So question 3, what signs and symptoms would alert you to a serious illness? Daisy.
Okay, well if she seemed sort of really quiet and withdrawn, or even more than that, she was sort of floppy and decreased response, obviously I'd be really concerned about that. If she did have any immediate signs of photophobia or any immediate signs of neck stiffness, either in the history or on examination, if her skin was mottled, or she had any signs of poor perfusion, or if the peripheries were feeling cold, I'd be concerned about that. Or thinking in terms of skin rashes, if there was any sort of hemorrhagic type skin rashes, like a puric or petechial rash, or perhaps any signs of bruising, then I'd be concerned about that. And I suppose, if she has got a fever and I can't see any immediate cause of that fever, I might possibly want to do something else about that as well.
Okay.
Yeah.
Right. Question 4. After taking a history and performing a physical examination, you decide that this is likely to be a simple viral illness.
Okay.
What advice will you give the mother?
Right, okay, well if it's just a viral illness, I would try and reassure and say, okay, there's nothing to worry about here. At the minute, I ruled out any serious illnesses. So in terms of advice, I just tell her to monitor the child's temperature closely, making sure that she's got, ideally got some means of recording it. Advise her on using paracetamol or ibuprofen regularly at the correct dose to make sure she's got some of that available. To encourage fluid intake in the child and to monitor her fluid intake and also her appetite, because if she was off her food or fluids, that could indicate a worsening illness. I'd also tell her to keep an eye on the child's urine output as well, make sure that wasn't diminished from normal. Look out for any potential serious symptoms like any headaches or light sensitivity or neck stiffness, and also to look out for any sort of hemorrhagic type rashes like I mentioned previously, and also to look out for any general worsening signs that might be noted. And really, if it's just a viral illness, we should see an improvement over the next few days. So if it was persistent or worsening, you should need to come back, and I'd need to make sure that she was aware of out-of-hours arrangements or going to a local walk-in centre if the clinic isn't open at the time when she needs to bring the child back. If it's just a viral illness, I might want to discuss about antibiotics with her, because she might think that having an antibiotic might be appropriate. But if it just looks like a viral illness, I need to tell her that's not the case.
Okay. Okay. Brilliant.
Yes.
Okay. Thank you.
All right then. All right. Fine.
And now we'll discuss with my colleague.
Okay.